Technically, once the patient has been marked out, they come to the operating room and they are anesthetized. I personally do all the injections. We start with the donor area, and I remove the donor area with a single strip. And I'm very careful when I make the incisions to minimize transection of follicles, because every follicle is important. Once the strip is removed, it is given to my staff, and it is always bathed in solution, and we keep the grafts cold and the strip cold at that point. I use a double layer closure. I feel that minimizing any tension on the wound is extremely important to minimize any scar formation later on. And I close the wound with suture. Once that's performed, the scalp then is anesthetized, where we're going to be doing the procedure, and we wait a little bit. I go then and observe how the grafts are turning out at that point. We sliver, once we have the strip out, it goes to one person who slivers the entire strip, and this is all our dissection is performed under the microscopes. The slivers are then cut into the individual follicular units. Once I know the size of the follicular units, I will then make the holes accordingly. So I tailor the procedure specifically to how the grafts are coming out. Sometimes the grafts are smaller and sometimes they are larger, and I am able to use a custom blade cutter to specifically match the size of the blade to the grafts. Once I know I have the appropriate blade size, then I will go and make the appropriate slits. Once that's performed, then myself and another technician will insert the grafts. What sets me apart, I think, is that I personally insert many of the grafts. I spend most of the time in the room with the patient. I do have several other staff that will insert grafts, but I personally make sure that the case is going smoothly, and by inserting at least half or more of the grafts myself. Because I do that, I'm only able to perform one transplant a day. The grafts, and another reason why I insert the grafts is I perform my own quality assurance. The grafts are cut by the individual cutters, and they come to me with their name on the trays. And I want to assure that my staff is cutting grafts to my specific needs, because I want the grafts to be absolutely perfect.